So good day everyone, my name is Jessica and for today we will be assessing the patient's vital signs. But first and foremost, we have here the materials. We have first is the BP apparatus in where we could measure the blood pressure of the patient later. We have here the alcohol to disinfect our hands. We have here the digital thermometer to measure the body's temperature. We have here the dry receptacle and where it is composed of dry cotton. We have here the wet receptacle and where it is composed of cotton balls that has 70% alcohol. We have here the empty receptacle which can be used for waste later. And also we have the alcohol pads if necessary. But let us not forget also the stethoscope enable us to hear the pulse later. And lastly, we have the watch with second hand to measure the respiration rate and the pulse rate. So before we wait or while we wait for our patient, let us wash our hands with alcohol first. Okay, hello ma'am, good morning.
Good morning.
My name is Jessica Bermido, a student of the University of San Agustin in Araneta del Bisubong para mag-assess sa inyong mga vital signs. So may I ask ma'am for your name?
Marie Angeli Acap.
Okay, that is spelled with I-L-E. And 17 years old, is that correct?
Yes.
Okay. So ma'am, before we start, or we will take your vital signs today, just so you know. So before we start ma'am, ma-rest ikaw anay for 5 minutes to have accurate results, and while we are resting, I will also explain what vital signs are and its importance. Okay. So vital signs, ma'am, are the indications of the body's function. It has temperature, your blood pressure, your pulse rate, and your respiration rate as ordered by your physician that is needed. Okay. So, ma'am, I will also ask you if okay lang ba lang na dili kita ma-perform some aton nga vital signs, mag-take vital signs, or gusto mong in a private place?
It's okay, very long.
Okay. I will give you a little moment for yourself to be well rested. Okay. First, we have here ma'am the digital thermometer and where meron siya ma'am kinds of where we could measure your temperature sa rectal, oral, and axillary. Prescribed by the physician, diri na lang sa imong mga axillary as needed. Okay, ma'am, can I insert this in the axillary or in the pillow? Okay, now we will wait until it starts to beep. Just tell me, ma'am, if meron ka na hear na beep or I will also do it myself. Okay, ma'am, I will now list down here your temperature and it is within a normal range naman. So ma'am, let us now proceed into assessing your pulse rate. So ma'am, imo pulse rate amo na siya ang beat man sa imo heart. So it is measured beats per minute and amo na siya ang pag-circulate man sa imo blood and number sa imo pulse rate amo man na ang beat sa imo heart per minute. Okay, I will ano it by, can you please put your arm in a direction? I can, your left arm, yes. Also, ma'am, I will put my 2 fingers in your radial pulse as prescribed also by the physician. And it is the most common na place in where we could assess your pulse rate. So I will assess it for a full minute. Okay, we are done, ma'am. And also, while I was checking your pulse rate, I have made sure that you are unconscious on knowing if gina-check ko yung mga respiration rate at the same time, because it may alter the result if balaan mo maginakwaan na ka or gina-observe ko ang pag-rise and fall sa imong chest. So, ang respiration rate mo muna siya ang makadetermine naton kung ano ang imong respiratory status. So, the rate and the rhythm seems to be normal and has a rhythm of a normal as well. Okay na, ma'am, kita sa imong blood pressure. So, ma'am, before ako magpa sa imong blood pressure, may ask if may ka sa previous na surgery, sa imong breast, sa imong surgery, kay basi mo or something.
No.
Any wounds? Wala na. So, before tama magpa, ano imong typical na blood pressure? Like, normal range, average?
120/80.
Nasaan mo na ikaw last na ginagawa?
Last 2 weeks ago.
Okay. So, bali ma'am, ang atong blood pressure, ang na ang force ng atong blood sa atong arterial walls na mag-contract na siya and will make mabala natin if high blood ikaw or not gamit sa gauge ini. Okay. So, bali ma'am, ang first na beat ng atong mabatian is the systolic pressure and last beat is the diastolic pressure. So, ma'am, I request you na ibutang yung hands sa 90-degree angle and can you lift your shirt para mabutang. Okay. So, I will be placing this, ma'am, and also you will feel a compression sa iyong mga arm and it will be fine or it will be okay right after. Okay, so I will also put 2 index finger or 2 inches flat so that I could place the pulse or the stethoscope later. Okay, are you comfortable in so many ways? Okay. I will now put, ma'am, the stethoscope and I will find your pulse. Can you please put your arm in a fist? Okay, so we will feel a slight compression na din, ma'am, ha? Okay, so your blood pressure is normal, 120/80. So, I will now remove it, ma'am. So, feel any discomfortable or anything like that. Okay, so I will see first the So, before I endorse you to the physician, ma'am, or I will send you to a physician, kindly wait and make yourself comfortable. Thank you so much for your cooperation.
Thank you.